Welcome to Driven Together. The idea is simple. Put a friend or a stranger in a Tesla, let the car drive itself, and then ask absolutely enormous questions about the future of humanity. What could possibly go wrong? This is Lori Quayle,
Hello.
and she is with the company.
Well, I'm my own agency
Oh, so
now.
private
Yes.
agent,
So
okay.
I'm a private Medicare agent. Work with almost all the major carriers representing
Okay.
Medicare Advantage, Medicare Supplement. Thanks for the coffee.
Yeah, you're welcome. Enjoy it. So what I'm going to do is I'm going to tell it a location. I've thought of one that's fairly close, and we'll self-drive over there. So navigate to Johnstone Paint and Decorating. Over on Buttonwood.
Yeah.
Hit that. And away we go.
How long did it take you to get used to that?
You know, at first it was a little bit nerve-wracking, you know.
Oh, I could imagine.
But what's going through your head right now?
It's just kind of crazy where we're at from a
Technology
standpoint. And yes. It's like mind-numbing almost. It's amazing, but scary kind of at the same time.
Yeah.
You know?
Yeah.
AI to me, or just technology where we're going, but yeah, this is crazy.
Do you think about it very much?
I don't think I think about it a lot, but yet I do believe that it's important to start thinking more and more about it. You know, I mean, it doesn't keep me awake at night, but definitely, you know, I think and I'm already utilizing AI in a lot of ways. But, you know, especially in my field of work, as we discussed, you know, I think you either got to get on the wagon or you're going to get left behind.
Yeah.
In any field, really, going.
What do you personally do that's different now with AI?
So right now, more than anything, like if I'm creating a document or I'm doing something, I use AI or ChatGPT, or
Okay.
I use Claude, or you know, I'm looking at a new business venture, and I've looked and researched, you know, legalities and, you know, ways to form that, and then questions we should be asking or thinking about. So that's incredible because it does so much of the research that, you know, we would be doing. And then, you know, as far as the different companies that represent, you know, Medicare policies and that type of stuff, I just went to a meeting, in fact, about a month ago, as we prepare for the upcoming annual enrollment period and everything, that all of the companies, Humana, United Healthcare, etc., are all using AI to maximize the time that I would have on the phone with them, perhaps, or if I'm researching something, or a client or a member calls in. I mean, it's crazy.
Really?
That they can take like doctor notes, the past history, what the client is saying or the member is saying, and within seconds come up with details regarding what the protocol is, or what, you know, the next step would be.
Really?
This is kind of freaking me out, I have to admit, like looking at you and sorry, you're not touching the wheel, and I'm like, oh my gosh, we're moving. Sorry. Try not to be distracted.
Well, that's part of the point of doing it in the car here,
Yes.
you know, because it's such an example of technology. It's one of the more advanced little endeavors that's going on right now.
Yes. And I honestly, I'd say within the last couple weeks, I'm warming up to the idea of a Tesla or a self-drive car.
Are you?
I am. You know, before I was like, I would never have one. But again, it's kind of cool that you can do that. And have you fallen asleep or anything yet?
No, you can't do that.
Right.
It wants you to keep paying attention. I mean, I can look over at you for a fair amount of time before it'll turn blue and start warning me and stuff like that. But
It even parks.
but it'll park. Yep.
Finds the best parking
So
spot.
that's that's the program. So back to what we were talking about. Do you feel, or how do you feel with the technology now that it's doing so much of the work? What's going to be left to make people uniquely human in the whole picture?
That's a good question. I feel that some of the capabilities that we'll have and some of the quickness that we'll be able to research things will be amazing for us as agents, but also for the client. But yet I think that human touch and that compassion and the care, which I feel is one of my strengths, because I really do care about people and want to do what's best for them. That's important. But like, for example, say somebody calls me and they're like, I want to have the best dental plan possible. And I really want to know if I could get dentures. Well, right now I would have to go into every explanation of benefits that sometimes is well over 100 pages. Go through, do the, Control F, find the dental, drill it down, but then it can be open to interpretation. Now, if I put all those EOCs, evidence of coverage, into technology, or
put it into AI.
Thank you. It will. I'm still like looking at your car and stuff going, this is freaking me out. But put it in there and then ask them, or ask the question, who has the best dental plan? And I have all the different companies that have dental available. It'll come up and say whatever company it is. Yes, this would cover their dentures. It'll give me exclusions. It'll give me facts and details that before could have taken me hours. Right. And now within minutes, I'll be able to go, oh, you know what? Let's go with, or, I would recommend this plan versus that. But, I think there are agents that now use some automated calls, like the robocalls. Oh, yeah. I don't foresee me doing that. Yeah. Unless it got really, really big. But even then, I think the human touch is important. That wouldn't be any fun. Yeah, I think most people do appreciate. Yeah. I mean, I know I get frustrated when I call like a business and I have questions or whatever, and unless your question is in that script, you just get caught. And then I know with mine, like, I was really nervous about getting the coverage transferred over to the different path, Right. And I just was able to trust you to give me the right advice and to do it at the right time and everything. And even so, I was still like, I hope I did it right, because if I did it wrong, then I'm in trouble, And so it all worked out. So it just gave me, I went in and I turned in my insurance at a visit, and it just went like clockwork. And so I'm like, whew, Yes. I love it when a plan comes together too. And again, there may be some ability looking at technology going forward that will assist with that, perhaps. But I think the agent's knowledge, their compassion, there's so many nuances sometimes in, healthcare and Medicare or wherever that, I think the knowledge of an agent is always going to be important. It's so complicated for us that, we really need, the trust factor is big. Here, I'm going to start us going back. Navigate to the ACA Business Club. Thank you for allowing me to see this in action. Oh, you're welcome. It's fun for me. Yes. So. Thank you for not making me drive. Not just the driving, but the whole change in technology. So we've got, job displacements coming along and things, and have you ever thought about, what kind of changes that we could make that would honor those people who are, sacrificing their jobs and try and, live in a way that sustains life for everybody? I do. I mean, I think about that fairly often. In fact, I was in a conversation recently with a colleague just talking about AI. And some of, I think it's the Kansas City Star that just laid off or terminated writers because
Oh, wow.
so much of the information can be found through AI, and really sometimes AI, and you may have to edit it, but a lot of the content's there. But anyhow, I do think about it because as I look to grow my agency, looking for perhaps some more assistants or more agents, I think that's important. And yes, I think I want to train them and show them what tools would be available via AI, through the different carriers, or like I mentioned, where you can research specific needs of a client, but to be able, again, that human touch is very important. So I hope to be able to help some of the people using the AI, but also help some people getting jobs and having that human touch as well, because we have that in common.
Right. Well, I think that the human touch is going to be like the last thing left for us to do. When more and more, like as our jobs get done by AI, I mean, what is there for us to really contribute?
Right. And I think, and I hope that there still will be a great want and desire for people to actually have, an agent or somebody to be able to explain or, share their situation in depth. Because yes, you could probably put, some information into an AI tool and it'll tell you information, but an AI person or research or search isn't going to allow for that human touch and for that compassion and that perhaps even some knowledge or whatever that the AI is not going to have. This is so cool.
It was going to try to go that way. So sometimes it gets confused in the parking lot. But.
Well, this is kind of a confusing area, I think.
So
this is good. I haven't had Scooters for a minute.
Yeah, Scooters has pretty good coffee. So the last question of the day is...
I don't know whether to look at you or look at the camera. I'm just
The last question of the day is, if you could give one piece of advice to humanity as we are passing this world into our children and grandchildren, what would it be?
One piece of advice. With technology and AI at the forefront, and so not to forget the human touch, and that truly is I almost get emotional talking, that's the most important thing. That, yes, technology is going to be, imagine what it's going to be like in 10 years, 20 years from now.
Yeah.
Like you said, when our kids and grandkids are grown or whatever, human touch and that emotion and the feelings that you can share with a human are going to go far beyond what you can get through any artificial intelligence or anything that technology is going to bring us in the future.
Well, let's hope for that.
Amen. Yes, I know. I agree. That's funny how that kind of got me emotional.
Well, that's pretty cool. I've really appreciated your participation in my little experiment.
Yes, it's cool.
So thank you so much.
Thank you. I was, when I got your call, I was like, okay, well, I wonder what's, my mind always goes, I wonder if there's an issue or a concern, And I was like, oh, that's great. Yeah, thank you. I'd love to.
Well, I happened to look on Facebook just last night. Oh, that reminds me. Your thank you card.
Oh, you're so kind. Thank you. You didn't have to do that.
Oh, I like to do those.
And coffee.
So I was looking on Facebook. It's like, wow, you really love life.
I'm an eternal optimist. I will say that. I love music. I love life. I try to see the positive in any situation. It's not always easy, but I try to. But speaking of Facebook and stuff, thank you for saying that too. And I do want to be, whether it's through Facebook or it's through encountering somebody, I try to be an influence in a positive way. And it's a natural thing for me most days. But like my children are hesitant for me to put anything on Facebook regarding my grandchildren or whatever, just because of some of the stuff that
that's a shame.
AI can do, or but that's a whole other thing. But yes, I'm very blessed, and I appreciate you,
Yeah.
your friendship, and your business. And
Well, I gave you a prayer on that from Abdul Baha. It's a very uplifting prayer,
oh, cool.
and I started sharing it with people, and so enjoy that.
I
and
will.
Thank you so much
Thank
for
you,
coming
Mark.
aboard.
Yeah, I appreciate the opportunity. I was like, "What are you doing?" And like I said, I'm excited about being able to. Now I've ridden in a Tesla.
Yeah. Thanks.
Okay, how do I get out?
You press that button
Here.
right there. Yep, press it, and then push on the door.
Okay.
Yep. You can't just be a.
See you later.
All right.
Thanks again.
All right.
See you later.
That was fun.
It was fun. Thanks again for the coffee too. and the
Okay.
coffee.
Yep.
I appreciate you.
You're-
Holler at me if you need anything.
Okay. Bye bye.
see ya.
So there you have it, episode 4 with Lori Quayle. It's great having you on Driven Together. And by the way, I'm not from Arkansas, but I visited there one time and I bought this t-shirt, which I like. Anyway, we'll see you next time on Driven Together. Bye.